Wearable workflow needs health systems engineering. I'm Chuck Webster. I'm Wareflow, W-A-R-E-F-L-O on Twitter. I tweet and blog a lot about healthcare, IT, and workflow. And here's my outline. I'm going to talk about what is a wearable. I'm going to talk about this idea, quote, wearable workflow. And then I'm going to talk about opportunities for health systems engineers, industrial engineers, management engineers, and the variety of folks who may not actually be engineers, but who are all part of that human factors, workflow improvement, work improvement family. And then I'll end with kind of next steps. So what's something that you could do to kind of to jump in at least to the shallow end of the pool and prepare for wearables in the healthcare workplace. By the way, this presentation is a draft preview, so I'm not giving you everything, and plus I'm working on a bunch of stuff, so it's going to be even better in February. February 18th and 20th in Orlando at the Healthcare Systems Process Improvement Conference. I've been several times, I loved it, and I'm looking forward to being there again. Okay, Venn diagram. On one hand, there is a universe of wearable technology, and it is a burgeoning universe. It just the new wearables are popping up every day, appearing on my radar, and as things become even more miniaturized, and as battery life improves, and as the wireless Internet of Things spreads its tendrils, we're finding more and more really kind of exotic, exciting stuff happening. On the other hand, we have health systems engineering. Now, I'm going to be talking about the intersection between wearable technology and health systems engineering with a particular focus on this subset, which is using wearables to improve work. Now, so much enterprise technology these days is actually driven directly or indirectly by the consumer and digital space. And so things like Google Glass that are very popular in a lot of pilot studies right now really was conceived by Google as a consumer item. And so I'm also going to fold into this some aspects of consumer wearables and also touch on this idea that wearables are a way for patients to actually become part of the workflow of the care team. Let's start with a definition. I like wiki definitions. I like them because they're representative, they're kind of popular, and in this definition of wearable technology says it's clothing and accessories incorporating computer and advanced electronic technologies. These designs incorporate both practical functions and features, but may also have critical or aesthetic agendas. And that's one of the things that I find most fascinating about wearable technology is that combines this sort of practical functional with this sort of fashionable self-image kind of thing. And there's a kind of a creative tension or conflict, and the way in which that is resolved is a very interesting bit of dramatic technological narrative. Okay, health systems engineering. I have a master's in industrial engineering from the University of Illinois. I also went to medical school, but there's a couple of other degrees there. But the degree that I've most used over the decades of working with health IT and electronic health records has been the industrial engineering degree. So I've in that design of that medical informatics undergraduate curriculum, we kind of modeled it on an industrial engineering curriculum, and so I had to look up health systems engineer. And I'm reassured by this statement in Wikipedia, although keep in mind it is Wikipedia. Health systems engineers are, in essence, industrial engineers by another name. So whether that's true or not, it's close enough that I can show you my next slide. And it's a wall of words. I'm not going to make you read them all. This is basically, a few years ago, I looked at a bunch of different industrial engineering programs and kind of did a synthesis. And now I'm going to get rid of a bunch of stuff. And this is the stuff that I think is relevant, highly relevant, to getting wearables to achieve their full potential, both in terms of patients using them and also healthcare providers and staff using them. So we have human factors, motion and time study. Can you imagine what Taylor and the Gilbraiths, those folks who founded industrial engineering and management engineering and healthcare, would have done if they had the time-stamped motion data? Just amazing to think what they could have done with that. Facilities, location, and layout. Tools, layout. Well, think about wearables, the jawbone that I have on my wrist, the Google Glass. These are tools, and so your handedness and the relationship between the wearable and the other tools that you're grasping, and that layout is relevant. Understanding sort of the flow of tasks and information through a complicated system. These notifications are arriving and bothering people, and they're responding or not, and modeling all that. Understanding the implications for throughput, quality, error rate, rework, bottlenecks, classic queuing theory, decision analysis, simulation, all relevant to understanding the impact of wearables on work and workflow in healthcare. Quality management, one wants to measure the impact of wearable on quality. Automation, impact of computers on design, implementation, management of complicated production systems. And finally, someone's going to have to sort of take the big picture, the systems picture, and design that system, and then there's the project management aspect of rolling it out. Now, last year, I gave a presentation on Google Glass at the conference, but I want to tell folks here that Google Glass is not the only wearable. In fact, there are hundreds and hundreds of wearables on just basically every part of the body, every layer of clothing. There are smart shoes that, the left or the right shoe will vibrate, and they're connected to GPS, and they will give you a tour of the city, or someone who is blind can rely on them. There are, of course, the smart watches. Last week, the Apple Watch has really sort of raised those profiles. Of course, Android Wear watches have been out for a year or so. There are the bracelets. I wear the Jawbone activity monitor. Gloves, rings. How about this? Now, I'm not going to go through all of these, but I just want to say that about a month and a half ago, there were two major wearable technology conferences. One was in New York, one was in Los Angeles, and Google Glass was only a minority of all of those presentations. There's even smart rings. So the smart ring is connected to your smartphone, and it vibrates, and it's connected by Bluetooth. And basically, if you have a very high priority person that you only, if you get an email you want to answer that, they'll vibrate, and some of them even have little LCD screens to show you a symbol. Wearables are big. I think the fact that you were here is testimony to that. Now, this is the classic hype cycle curve. At the beginning, there is a technology trigger. And in this case, we're looking at things like miniaturization, battery life, wireless Internet of Things, and those combine to create a set of products and services that were not possible before. And you end up climbing up to this peak of expectations. Now, I'm not sure where we are on this, but I think we're not quite to the peak yet. And then people try all kinds of things. Some of them don't work, some of them do, and then the best practices become that which makes this plateau of productivity possible. Now, I tweeted this the other day, and I was really astonished. I'm a great fan of my Jawbone here, and look, it has Jawbone. $471 million of private investment. I have no idea how many people have the Jawbone, but almost $500 million of private investment. Amazing. And the first thing I thought of when I saw that number, and I went, you know what? I only have to charge my Jawbone every week or two. And I have it connected up to a tablet that's always on, and it talks by Bluetooth, so I never have to plug it in to synchronize. It just automatically is there. And in the meantime, it's sending me messages and encouraging me and vibrating to tell me to get up and walk around. And it's a very so that combination of battery life and convenience, because I don't have to connect it up. I think there's a connection there to the successful investment. However, and I think I'm alluding to this, wearables are currently flawed. Amongst many wearables, battery life is problematic. Notice at the Apple Watch conference last week, they didn't mention battery life. Some folks just don't want to have to charge their device every night. Pebble lasts longer than that. Form factors. So if you've got a small screen, so for example, Google Glass is 640 by 360 pixels, and so you can't put as much information on it. And if let alone a smart ring, and if you don't have much room to put that information, you have to be very, very intelligent and very, very careful to only put the relevant information and options if you're responding to a notification. You need to be so smart in what you do. And guess what? A lot of electronic health records and a lot of health information technology isn't particularly good yet at finding just the right information to give to the right person at the right time. Aesthetics. I'm as an engineer, I'm kind of, the word isn't oblivious, but I walk around with Google Glass and I notice that people kind of, will glance at me and so forth. I've had no negative experiences, but I'm also kind of careful. Whenever I walk in someplace, I take it off until I kind of get the lay of the land. If I see someone and they walk up to me, I will put it on my head or take it off, kind of as a sign of courtesy. I will say I did an experiment yesterday. I was at the Consumer Health IT conference here in Washington, D.C. So Consumer Health IT. Wearables were an important part of that, and there were conversations about workflow as well. How do you integrate the data that's patient-generated and coming into these EHRs and getting them into the workflow? And anyway, I did a survey. I said I took a piece of paper with me, and I said I'm going to, every time someone asks me about it, I'm going to turn around and ask them, how do you feel about Google Glass? Positive, neutral, or negative? And interestingly enough, at a conference I went to in June, lots of people came up. Hardly anybody came up. A total of 4 people came up, and it was 2 positive, 1 negative, and it had to do with privacy, and 1 was mixture. And then when I left, the guy who was delivering the mail and the concierge just demanded a demo, and there were quite a few. So that worked out to be 4 to 2, so to speak. Workflow, I think, is such an important issue. On one hand, 1 in 10 Americans have activity trackers. On the other hand, as many as 50% of these are discarded after 6 months. So, there's great potential there. There are these issues, and one of those issues is workflow, and systems engineers and industrial engineers know about workflow. So I think there's an opportunity there to make wearables all they can be, as well as use wearables to improve kind of classic healthcare and hospital industrial engineering concerns. Okay, between 2004 and 2009, there was a research project in Europe called Wear It at Work. You can Google it. And dozens of companies, half a dozen countries, tens of millions of euros were spent on developing prototypes in 4 areas, including healthcare, and developing infrastructure and models and theories and definitions. And this came from the summary document, in which they were talking about wearable computing. They said, well, the goal of wearable computing is to eliminate the distinction between information processing supporting a task and the task itself. So if you think about that, if you eliminate this distinction between information processing supporting the task and the task itself, well, designing information systems and designing work really becomes the same thing. And then there was this quote here: wearable computing assures especially that processes become more straightforward, the quality increases, and idle time decreases. And I think of idle time here as including that time to go off to your laptop to look something up or to pull something out of your smartphone, to take it out of your pocket and find it. And we'll come back to this idea of getting rid of the distinction between information processing and supporting a task and a task. In fact, you can think about, remember when the desktop came into existence. I'm talking about the virtual desktop. What they did was they took the real world desktop, and here's the trash can, and they recreated it in the computer. So you drag a file onto the trash can. Well, wearable computing is about taking that virtual world and putting it back outside into the real world. A very popular phrase in wearable computing is context awareness. So watches are context aware, Google Glass is context aware. What does that mean? I love this Rudyard Kipling, a bit of poem here. I keep 6 honest serving men. They taught me all I knew. Their names are what and why and when and how and where and who. Well, where? Where outside? That's GPS. Where inside? That's iBeacons. Who are you? RFID. How you were doing something, how you were doing the task. Accelerometers are tracking motion. And all of those fit together into a set of stimuli. And that stimuli interacts with rules. These rules are triggered by the context, and they are also suppressed so that the right information is placed in front of the right person at the right time, and that's workflow. This is I gave a presentation at a Wearable Healthcare Society conference in Indianapolis, and there were 20 talks over 2 days, and 19 of the talks are about glass. So in contrast to those 2 major wearable technology conferences, 19 out of these. And of all the verticals, probably healthcare has the strongest case for this, for hands-free and highly sophisticated, cognitive, multimedia interactive device. By the way, I gave a presentation at this conference about something I call a wearable robot, which is basically a platform for me to explore some of these wearable workflow ideas. It's a kind of a fun thing, but it also has a serious reason. I'll mention up here on the right, of course, I don't know if anybody saw it, but this is my little ad that I put on my blog. You might have clicked through. And there's a stick man here, and there's Google Glass and a smartphone and something on his wrist, this jawbone, and all these things are interacting with each other. I will have to say I've had glass since 2013, and it wasn't until I started interacting with some folks beginning to use glass, intending to use glass in healthcare, that the whole workflow angle kind of crystallized. And so Pristine is down in Austin, and they're doing a couple of things. First of all, they're streaming live video from the EMT to the trauma center. The anesthesiologist can monitor multiple rooms because he can see through the eyes of his assistants. And then they also have checklists that are hands-free that you control with your voice. So you could imagine that that's important from the point of view of not breaking your sterile field and so forth. And so I wanted to mention them. And then also there's a company called Augmetics in San Francisco that recently has secured almost $8 million in private investment. And essentially what Augmetics is trying to do is to increase the usability of the health IT systems and the electronic health record systems that the physicians and other users experience. And they estimate that up to 25% of the interactions between the physician and the HR can be replaced by feeding that information intelligently and automatically to the physician. You can think of, so that should hark back to that phrase, that notion of trying to eliminate the distinction between the information processing necessary to do a task and the task itself. When I think of wearable workflow, I think of 3 kinds of wearable workflow. The first kind is intra-device. So you're interacting over time with that device. And so I use as the example here Jawbone. Jawbone it monitors my sleep, and it's actually calculated the optimal time for me to take a nap. And if I nap any longer than that, then I get sleep logged, so to speak. So there's something called a power nap. And so I press a little button, and I'm actually, you can't see it, but I'm looking down. I have my bracelet, and right on the end there's a little button, and I press it twice, and then I press it long, okay? And then that's an instruction for it to allow me to sleep for 45 minutes, but no longer than 2 hours. So if I fall asleep immediately, it'll go bzzzt at 45 minutes. If I don't fall asleep, it takes me an hour and 15 minutes to fall asleep, and then I finally do, well then it'll let me sleep until 2 hours. If I don't fall asleep for an hour and 45 minutes, it'll only allow me to sleep 15. So that's the kind of, you think about from a workflow, to me, as an industrial engineer, workflow is a series of steps consuming resources, in this case, attention, and achieving a goal. And there's quite an intricate little workflow between me and the jawbone. And then there is inter-device wearable workflow. And an example of this, and anybody who has a smartphone like an iPhone or Android has these notifications that come in. And of course, you have these various apps, and you can turn the ability of it to send a notification on and off so that only the most important stuff shows up. They gave it as an example last week during the Apple Watch launch. A notification appears, so your phone goes bzz, and you glance at it and you see the beginning of an email message or summary. And then if you reach in your pocket and you pull out your iPhone, it automatically opens up to that email so that you can answer it. Or someone sends you a video and you get the notification, you pull your iPhone out of your pocket and the video starts to play. So that's the kind of cross-device workflow we're talking about. And then there's enterprise wearable workflow. And there's a couple of screens here this is from a prototype that I built with some partners. And it's just a prototype because glass is not out retail yet. And on the left here in the middle, it says 50% of rooms have been cleaned, and then there's a little pie chart. So the environmental services supervisor steps off an elevator, snaps a picture of a QR code, and then they get this little report. If you drill down, it shows you which rooms remain to be cleaned. Or if you go to a room, on the right, we see request clean. So if you snap a picture of the QR code, you can say, okay, I need to request that this room be cleaned or re-cleaned, or you can add a comment. So that's an example of people interacting with each other, and there's some kind of backbone that's off of the person that is coordinating these tasks. Okay, if I were teaching a 3-credit course in wearable health systems engineering, this is what I would teach. Now, I'm not going to drill down in these 3 areas like I will at the keynote. And also, my intention is to leave some time at the end of this presentation for actual conversation. So, if you ask a question, feel free to kind of identify yourself in that question, or even make a comment. And of course, the folks here that are moderating this will have to, play traffic cop on that. Number 1, we have, again, classic industrial engineering topics: human factors and workplace ergonomics. So human factors, you think of, the 5 or the 6 senses, depending on whether you include orientation and space. Take vibration. So what is the minimum amount of vibration necessary to rise above the threshold to get my attention? How about frequency? Does that matter? If I choose to ignore the vibration, if the vibration is, what is the maximum threshold beyond which I would be distracted and unable to ignore it? Attention is like a spotlight. So you're focusing on some task, and then something calls you away. Well, you move that spotlight from one task to another. So you've got to sort of understand, have a model of the work, have a model of the workflow so that well, don't interrupt at this point. Or, yes, interrupt because the next likely thing this person wants to do will be, to tap on the watch face and make it so. Workplace ergonomics. So just like, laying out the desk and making sure it's the right height, wearables are tools. They're tools that happen to be on our body. And these wearables interact with other devices, and whether you're left-handed or right-handed, and the devices are hanging out there, and they are left-handed or right-handed. So classic work design, workplace ergonomic issues. Systems engineers have a particular interest in time-stamped data. And so we have a series of events. A widget arrives, a light flashes, so a task is ready for you to be accomplished, and then it takes so long for you to get to it, and then it takes you so long to accomplish it. And these sensors and these interactions, these notifications of, yes, I got the notification, yes, I completed the task, or postpone that, please, or reassign that task, please. All of that information is just extraordinarily rich information for creating and understanding those models of work that can be leveraged in a variety of ways. Just think, as I referred to Frederick Taylor and Frank and Lillian Galbraith, the sort of the grandfathers and grandmothers of industrial engineering and in effect health systems engineering, what they could have done with that kind of timestamp data. And I'll be talking about that. So now, let's say you understand the physical limitations of the hardware, you understand the psychological limitations of the user, you understand the relationship to the workplace that they're working in. You've instrumented this so that you can take that data and find the bottlenecks, find the reworks, find the delays, look at classic sort of key performance indicators, throughput, cycle time, error rate. And you take that and you put that together, and the next step is, well, let's design or redesign this wearable workflow. And when I say design or redesign wearable workflow, I'm really saying design or redesign work. Because remember, it's about eliminating the distinction between the information processing necessary to accomplish a task and the task itself. And in general, the history of health IT is you have to do, back in the 90s, in order to create a web page, you had to write a lot of code of HTML. Now you can, now it's WYSIWYG and templated and so forth. And similarly, you won't have to be a Java or C# programmer to create systems of wearable workflow, systems of virtual work that's interacting with the physical environment. There's going to be drag and drop systems to create and to deploy, and all kinds of analytics that allow you to sort of compare laying the design out this way versus laying out the design that way. And so what behooves you to learn about are the platforms, because the platforms are like the operating systems, the components that you put together, and the tools that allow you to design that stuff. And so right now, these platforms are coming into existence. And in fact, I think the real battle between the various folks who are investing in the wearable technology space is really at the platform level. So here I've listed Apple HealthKit, Google Fit, Android. Notice in parentheses I have iOS and Android. We're going to see cross-device data and notifications, but I think some systems are going to be more centric than the others. So iOS-centric, Android-centric. Samsung is Android-centric. Now I've included here 3 Google Glass companies, just because I kind of came into this arena in the glass workflow angle. Pristine.io is as I described, but they're also understanding that glass is going to have to interact with the smartwatch that you're wearing. So when you send a notification, do you send it to both? Do you send it to one or the other? In which case, which one do you send it to? Same with augmetics and wearable intelligence, which I believe got about $8 million in investment recently. Now, over here on the right, we have Salesforce. Now, Salesforce is just a massive consumer relationship management system in the cloud. They're interesting from the point of view of workflow because they have workflow technology. They have workflow engines, and you can draw out a workflow and turn a crank and have an application. But they are supporting multiple devices in their wearable platform. And they have a partner in healthcare, Philips. So that'll be interesting to see how that works. Vendrico is in Vancouver, Canada. Very interesting company. They have a platform called the Canary Messaging Platform, and it's very agnostically cross-device. So you think about bring your own device, or bring your own wearable device, or being able to choose between whichever devices you want to supply to patients or to providers. You needed an adapter. You need a bit of software that actually talks to that device. And the second thing is that message, that notification has to be formatted so that it fits on the square or the round watch screen, or fits on the 640 by 360 Google Glass screen, and so forth and so on. And that I'll mention them here in that regard. And you can see other wearables like Pebble who are reacting to this sort of platform race with hints that they are also looking at getting into the platform business. My fun project, and I'll bring Mr. Rimp, R-I-M-P, to the conference. He's basically, he's an interactive pocket protector. He slides in the pocket, and he's for pediatricians and child life specialists, and folks who work in hospitals. And in the middle here, you see there's a little 8x8 LED screen, so you can show all kinds of icons that are animated. And he's got a mouth here, which is the speaker, and he does text-to-speech, and so he's talkative. You can see the little switch over here on the right. And I control him from Google Glass, so it's kind of like a ventriloquist act. I can make him act all kinds of certain ways. And I built him out of Bluetooth, Arduino hardware, 3D printing. The next version of him will be prettier, although I'm not necessarily sure that that's a good thing. But he's essentially a platform to study wearable workflow. I'm intending him to talk to the smartwatch. I'm working on a little, what I call Smarty the Watchdog, which is I get a hand to a child, and as they interact with it, it's communicating by Bluetooth to Mr. Rimp, and Mr. Rimp saying, "Oh, he likes that. Oh, careful." Okay, so that was the fun part. Your next steps. I would say, and of course I may be already talking to a lot of people who already have a wearable, in which case maybe just look at your wearable a little different, or delve into the data. Take a look at, well, how can I download this data and in what format? Or if you're a programmer at all, say, well, can I call it? Because what we're going to see is the people in the MIS department and the medical informatics R&D, practical R&D groups in hospitals and medical centers are going to be going there, and they're going to need collaborators, someone who can kind of be in between sort of the clinical workflow and working with those folks and the IT people who are having to understand that workflow. And if you get a wearable, you'll learn about, well, how do you set it up? Is it a hassle or not? You'll learn about battery life. How important is that? Connectivity, how important is that? And the point here is that consumer wearable hardware drives enterprise wearable hardware. And as Google Glass, it may be very successful in healthcare. It was originally conceived as a consumer device. There's this lovely word I call life hacking. So life hacking is all about how people can kind of rearrange their workflows, little inspired changes that increase productivity. That kind of personal wearable workflow is going to resemble a lot experientially with professional wearable workflow. So as physicians and nurses and so forth start to use these systems, one of the important things about being a designer is you have to have empathy with the folks that you're working with, and that's one way to achieve that. If you don't want to get a activity tracker, get one from your dog. So if your dog is a little chubby, there's FitBark, Whistle Tag, and these things produce really remarkable reports. They'll tell you fun things like how much quality time you're spending with your dog, how your dog compares to other dogs. And one of the points is that, every time when you're at home, your dog is running around and happy to see you. But guess what? You think that dog is running around when you're gone. Well, no, it turns out you can actually see that the dog is just sleeping in the corner. And there's a kind of an analogy that would be too easy to stretch too far. But if you think about, kind of viewing it as a therapeutic intervention that gives you experience on the kind of the clinical side, if you will. Smartwatch. Android is out now, and as Isaac has played around with, I think, Samsung Gear. Apple will be out in early next year. Then there's also Glass. It used to be that you had to actually apply to and get invited to get Glass. It's still $1,500. You'd have to have a very specific reason to get it. You may know some folks who are thinking about, maybe developing some software. A lot of these pilots are in medical centers where folks are doing that. Or you may have some use for it, such as using the video to document some workflow for some purpose. But it is probably the most sophisticated of the wearable devices out there at this point that are I would say, that are above a certain level of polish, because there are other more expensive, fancier smart glasses. But I think I'd take a look at that first. So thank you. I really intended to leave as much time as possible, because I'm hoping to actually, it's not so much questions, although I answer questions, but I'd love to get in the comments people just to introduce themselves. I am so-so, I'm with so-and-so, and this is, and keep it short though. And this is my next to last slide. I'd like to wish everybody a happy National Health IT Week. Yesterday I attended the first day, which was the Consumer Health IT Conference, lots of wearable and workflow stuff. And what I'm showing you here is there's a URL, ehr.biz/NHIT week. EHR, I'm going to say it again, .bz/NHIT week. If you go there, you'll actually see Mr. Rimp. It's a minute and a half long, and he says he loves Health IT. And I want to thank HIMSS. HIMSS is over, Mr. Rimp doesn't have many followers, but HIMSS, which has over 50,000, tweeted this out about Mr. Rimp. Anyway, questions, comments, short introductions. You can get a hold of me. There's my email. There's my Twitter account. If you just search for my name, Chuck Webster, Charles Webster, MD, you'll find my blog, and there's a contact. And of course, you're welcome to follow Mr. Rimp as well. And then I look forward to whatever Isaac and Heather have collected. And like I said, I've intentionally left a good 15 minutes here. And the keynote will be even more jam-packed, and that is the end of my presentation. And thank you. Back to you, Isaac.